Good afternoon, everyone, and welcome to the Bear Experiment podcast. Today, I'm very, very excited to be sitting with one of my best childhood friends, Yelina Fernandez. Well, let me rephrase that. Dr. Yelina Fernandez, who is now specializing in autism as a clinical psychologist. Welcome to the show, Yelina, and thank you so much for sitting with me.
Thank you, Monica.
So
doesn't matter how many degrees I have. I'm always going to be Yelina, though, right?
She's always going to be Jelly Bean. Jelly Bean. So we've literally known each other since 3 years old, right? We established this when I got here from Cuba. My parents rented an efficiency across the street from your parents' house in East Hialeah. So we were playing when we were 3 years old. So and technically, I am your oldest friend. I want to make that very clear to Marilyn and to Marlis. Okay? I was here first. But yeah, it's been many, many, many years. We've grown up together, on and off friendships for so many years, but always there through thick and thin. And I'm really grateful for you to be sitting here with me today and talking a little bit about...
Happy to be, too. I'm proud of you, my friend.
Thank you so much. So Yelina has, worked in the public school system, right, as a teacher, as an educator for over 17 years. I mean, that's really what I've known your profession to be in for many, many years. And some of the work that you were specializing in was with gifted students, but as well, you were also working with autism and as an autism inclusion teacher. Correct?
That's right.
So why don't you tell us a little bit about what exactly is an autism inclusion teacher?
Basically, an autism inclusion teacher, in my case, was a teacher who taught general education. So in my case, I taught second grade. I taught a general education. It's a regular classroom setting. And students that were diagnosed with autism spectrum disorder were placed in my classroom, either for an hour at a time or to do the reading block or the math block. But I was usually whatever school I was at, I was usually the designated teacher that had a general ed class, and higher functioning kids with autism were able to join my classroom.
Okay. And how many years were you working in this specific division of the school, of the education system? Did you start off right away?
Yeah. So right after college, I initially started off with as a writer, as a creative director at the newspaper, which turned into teaching. My early years of teaching, I taught second grade.
Okay.
What happened was, very early in my teaching career, I got interested in teaching gifted learners. So I got gifted certified and a few other certifications. And amongst that group, I started seeing kids with autism. At the time, I didn't know that it was autism, but I was very interested in knowing more. What was it about? So I would go up to the autism coach at the time, Alicia Pelelis, which she's my dear friend, mentor, and I always say the reason I got into autism, she's very well known in Broward County schools, and I went up to her and I was interested. So when she saw that I was interested, she was very surprised. At the time, people were kind of scared, teachers didn't know what to do. So I was very open, and she was very grateful, and she had a lot of kids that she was working with in the special program inside the school that were very bright. And I can remember one specifically. And I taught him math, and he was a second grade student, and he was nonverbal, but I was able to teach him second grade math. So throughout those experiences, the more and more I dove into my role as a teacher, I always like to say that somehow autism just kept following me around.
Right.
It really did. I taught in Georgia.
It's almost like the purpose that you've, and it's true because
it's followed me. It finds me
for as long as I can remember. Us hanging out in our adult life, right? Like, it's always been kind of like this specialty that you've always kind of geared toward in whatever division of your life, whatever portion of your life you're at, right? Whether it's in the public school system, now you're getting your PhD. So let me backtrack a little bit, because you said that, okay, so you're starting and you're working with the gifted students, but you were noticing something different about these students that were diagnosed with autism. Why don't you elaborate a little bit more about that? What was it that you were noticing with your experience?
I was noticing that these kids were kids that they were very smart.
Right.
That even though they were placed in a small classroom, and you can see by walking into the classroom that there were some behavioral concerns, but they were very smart and they wanted to learn and they were motivated. So I wanted them to be part of my classroom.
Okay.
And the moment I wanted them to be part of my classroom, then all the students wanted them to be part of the classroom. And then they just became part of the classroom. And for me, I embraced that difference.
Which a lot of teachers don't, out of fear or lack of education that maybe they can have also, because the student that's having a challenge verbalizing a communication, that has to be
early on,
right?
Early on, we just didn't know enough about autism. I mean, we still don't even know as much as we want to know, right?
And what do you think it is that now there's more light and there's more attention to autism?
We understand it more. We're more aware of it. We now know that there are gene biomarkers associated with autism. We now understand how it presents differently from one person to another. There's just so much more now. We are much better at diagnosing it now. So I think that's why we're seeing a lot more. One of the reasons that we're seeing one of the increases in diagnoses.
Okay.
Which is staggering.
So what was your motivation then to continue your education? And, you know, I've personally seen how hard it's been for you as, a mother, a wife.
Well, sure. Any job in the social services, being a teacher, elementary school teacher, they're not high paying. It's when it's they're not high paying jobs. So that's that could definitely be challenging. But the last few years that I was in the school system, which was in Broward, I was at Sea Castle Elementary with my great friend, Mr. Rodriguez, and he was actually the one who appointed me because to have an autism coach position in Broward County, you need to be appointed by the school principal, and at least during that time. So during that time, he appointed me as the autism coach at the school. So
there's only one autism coach per school?
At each elementary school. Well, at least at many of the elementary schools. I'm not sure what it's like now. I've been out of the school system for some years now. But at least during the time I was there, the elementary schools in Broward School were equipped with autism coaches. And that's the position I took for the last 5 years in the school system. When I was there was when I started reading through a lot of, like I would just read through a lot of reports that the parents would bring me. Or the school psychologist would say, oh, this one's diagnosed with that. And I started seeing discrepancies because I know autism. Why? Because I had it in my classroom for years.
Right.
All different types, boys and girls.
Right.
5, 6, 7, 8, 9, 10, 11, 12.
Right.
In Georgia and Florida. So I've seen it so much that I was disagreeing with some of the stuff I was reading. And I'm like, okay, like Oprah says, you gotta, do if you want to do more, you gotta know more. So
right. Knowledge is power.
I needed to go learn more, and that's really what motivated the decision to get the PhD.
So that was your motivation for becoming a clinical psychologist. Now, what exactly is autism? What does it entail? Explain to us exactly what autism is.
Autism is a neurodevelopmental disorder. It's something you're born with. It's more common in males than females.
Okay.
It could be diagnosed as young as 12 months. Those are some general concepts that I could say. In general, autism spectrum disorder is a neurodevelopmental disorder that is diagnosed when a person has 3 big deficits. And without getting into details right now, I'm going to say what those 3 big deficits are. Number 1, they have a very difficult time having a social life. Most likely they don't have friends, or they may have a hard time having friends. They don't date. They may not be part of any social groups. Employment is hard. School is hard. So that's one of the big problems or deficits that we look for. Number two, we look for a lot of awkward, non-typical movements. We look for a need of sameness, a need for repetition in their life. All these concepts can look very, very different.
Per person.
Yes, it could be a 2-year-old spinning a wheel or a 39-year-old, walking in circles in their room. So it could look very different across ages and even gender.
That's so interesting.
But
so you mentioned that you can start diagnosing as early as 12 months old. What exactly is it that you're looking for at that point? I mean, this is a baby.
Yeah. So like I was saying, those big 3 areas, right? So we're looking for those social deficits, like they have a hard time communicating with others. Como que no le nace. Mm-hmm. It's not something that's innate for them. So that's one of the things. Then we look for those.
So from the point that they're a baby, you can kind of see the social reclusion that they already have.
Yes, absolutely. Yes.
No eye contact.
Yeah. So what we look for, the third area that I haven't mentioned yet, is we look for overactivity or either hyper or hypoactivity to the environment, to the senses. The senses are going to be under or over. Mm-hmm. So there's going to be some kind of dysfunction with their senses. So we can diagnose at times, this is not across the board, but maybe like a 12-year-old, a 12-month-old, like you just asked. Mm-hmm. Some of the things you might see is that they may not look at the parent. They may not respond to their name. Another very common thing is that you can give them any toy and they'll either start to cluster them or put them in groups or just line them up. Those are very telling symptoms that you should probably go to your pediatrician, who can then refer you to a psychologist for an evaluation. Amongst those, of course, there's also the very popular, or not popular, but it used to be known as one of the first common, which is not speaking, right? Your child's not speaking. Oh my gosh, it's autism. It's very important to know that's no longer part of the diagnosis.
Well, right. I've even heard on, many circumstances where they talk about that a male takes a little longer to speak than a female, just biologically. It's just something that we innately have biologically. So,
Yeah, so there is no language delay is no longer necessary to get a diagnosis.
Right. No, so then we're still talking about what are the signs, what are the symptoms when, you're talking about a baby as early as 12 months old.
Definitely the absence of language, the things that we look for is, when kids are little, when they're 12, in that toddler, early childhood range, 1 to 2 years old, when they play and they have fun, a typical child wants other people to play with them. So if they're not going, mommy, come see, that's something of concern. They should be excited with what they're doing, and they should look at mom and dad and say, hey, come play with me. If they don't want you to play with them, then you already need to start talking to doctors.
So a parent notices that their 12-month-old baby is not communicative with them, right? Whether it's not looking at them like what you're explaining, or trying to gather their attention to show them whatever they're playing with. How soon should a parent contact a physician, a therapist, to start diagnosing their child?
It really varies, because sometimes development could vary for different reasons. So it's not to say that we do know that early diagnosis is important for early intervention.
Correct.
Because we know the earlier you start intervention, the better prognosis for the child. However, sometimes it's hard to diagnose at 12 months. So it really depends on the child. But for me, it's usually parents, for the most part, start noticing by a year and a half,
right,
if the child is not walking or those milestones. Now remember that a child could reach all those milestones and start talking, and then by 2 stop talking. That is also a possibility, which makes diagnosing it even more complex.
So I've read a lot of cases where that's happened, where the child
there's a regression,
where the child is completely normal by our standards.
Yes.
And then at 3 years old, there's complete regression. And blaming it on vaccinations and the effects that vaccinations have had on children, and how that regression started after the vaccination. That's what the parents have noticed, and even the physicians. What's your opinion on that?
My opinion is the scientific evidence shows it. I mean, the first of all, the whole concept that autism is associated with vaccines, it's probably one of the biggest myths out there. And this came out of just bad media. It was an article that was published in the UK, and the article was debunked, meaning that the scientific study was not valid. It wasn't reliable. And unfortunately, the false results were shared through the media, and then the next thing you know, everybody thinks that vaccines everybody stopped vaccinating.
I mean, right, there was a point that parents were not vaccinating their children.
And if you look back at the data, especially out in California, and this is published by Temple Grandin in her book, you see that there's data showing a decreased amount of children being vaccinated out west and an increase of autism. So, are they related? Are they a result? No. We do know that you're born with autism. We do know that there's associated genes with autism. The complexity comes in is that there's a lot of different genes associated with autism, and not every individual with autism has the same genes. And it makes sense, right? We say that it's a very heterogeneous disorder, because what bothers one individual with autism is okay for another.
It varies from person to person.
So you really have to become very good at examining for those core symptoms.
So how long does it take then? You have the parent. I'm the parent. I bring my child. My child is nonverbal, non-communicative at this point. I'm very concerned. How long does it take for me to properly start receiving the treatment in order for my child to start fulfilling a better life?
Yeah, typically I meet with the parent and the child for 2 to 3 sessions. I conduct all, in the world of psychology, we have tests that we use to measure for autism to get more evidence. Then we combine that with our observations and everything the mom and the dad and the teachers are telling us, and we come up with a diagnosis. We usually meet with the parents 2 to 3 sessions, and then whatever time it takes to complete the report. So it could be anywhere from 1 to 3 months.
And how cooperative is the healthcare system and, insurances?
Not very. It's a really sticky situation, actually. Not many health panels cover the testing required. It's been my experience that the coverage is limited, and I've seen the struggles with families and having to pay
out of pocket.
And you're looking at anywhere between $3,000 to $5,000, depending on the nature of your case, of your child, right? Of your family history.
Now, how common is it for parents, a mother and a father, to have multiple children that have an autism diagnosis? Do you see that more and more?
So there is in terms of if you have a child with autism, your second child or the child that you have after, there is a slight chance, because we do know that there's genes associated, but we also know that there's twin studies that show one identical twin having it and the other one doesn't. Right. So what does that tell us? There is something in the environment that's interacting with our genes that's not it's not good for us. And we do know the studies show, because I get asked all the time, what is autism? What causes autism? We're like, well, we do know the studies show that, we've associated, a higher age for the father. We've seen
older parents.
It was interesting, Monica, because I remember reading an article about this and thinking, oh my gosh, yes, I remember as a teacher, I remember thinking of me always noticing very older fathers, totally anecdotal, right? Not research evidence, but But I just thought it was an interesting, but definitely, people are getting married later. There's a lot of people with autism that are doing much better, and they're marrying each other because you tend to gravitate to like-minded people.
That's interesting. That's
so
true.
A lot
That's
of people with ASD are marrying each other, having more babies with ASD as well.
That's interesting. That's very true. And and now people are pursuing a career, right? Their profession and a career more and more getting married later in life, having
Yes.
babies later in
So
life.
we've
It's
seen-
becoming the norm now.
So we've seen research that shows, older, paternal age, also some links with pesticides, like food-related
What about
issues.
food related? So I wanted to hit that
Yeah.
subject because they're pushing us, obviously, right, with all the pesticides that they keep putting into the foods. I mean, the more that you read about it and see it in the news and study it, it's really concerning.
There are specific
Right.
pesticides that they're concerned may be related to the, not just ASD, right? Remember, there's a lot of neurodevelopmental, I mean, what you're born with. That also includes learning problems, kids that have problems reading. What about the increase in ADHD, which is staggering too?
Right.
So that's why I think there is so much push with organic, especially with foods like the berries, because
Right.
you are consuming so many toxins. So hopefully the studies in the future will yield more about what specifically, but besides the diet,
And it's interesting because berries, for example, are one of the
Yeah.
fruits that you should be
Like the
eating the most because of the
antioxidants and the
antioxidants that
blueberries.
it provides, and yet those are the ones that are
organic.
that are being
at
poisoned
least
the
for
most.
those, yeah,
right.
yeah. And pediatricians
kinda like it's
tell
a
you
double-edged
the
sword.
dirty 10, the dirty dozen. There's really only, because you don't need to buy organic bananas, right? Because you have the peel.
Right.
So they tell you which are the ones that you really have to
Right.
buy organic.
Yeah, but then we
But-
go back to, the inflation and
Yeah,
everything
yeah.
else that's happening in this country.
Which-
Can we really afford to go to Whole Foods
Which you
and start
brought up-
buying organic foods? I mean, at this point, we have to be millionaires to be able to follow that lifestyle, or we have to be working in a cornfield where we're growing our own
It's
crop.
very difficult. And back to what you were asking me about the insurance panels, Monica, I can't tell you enough. And when I've worked with so many amazing families these past 20 years. And oftentimes I tell the moms, go get therapy, take care of yourself, because it could be very difficult, not just navigating, that first diagnosis of autism, but then there's a lot of stigma attached
Right.
to it, as there is with mental health, right?
Yeah, with mental health in general, right.
And it could be very expensive. You get a diagnosis, but the therapies, the treatment, what school do I go to? Does my child need what therapist? It's so many decisions to make. So I urge the moms, have support, go to your friends, have your own therapy, get support, because it's really, really hard.
And you beat me to that, because that's
Yeah.
exactly where I was headed in now with you. Is it's such a daunting
Yes.
position for a parent or a caregiver to just be in with their child. I mean, that is an extension of you. You want the best for that little baby. You want the best for your children. And all of a sudden now you get this very scary, because we're still learning. We're still growing with this, right? We're still trying to understand exactly what this is. There's the stigma, mental health. Is my kid going to be able to lead a regular life? Is she going to be able to get married? Is she going to be able to have children for herself? Are her children going to be autistic also? Is she going to have to deal with everything that I'm dealing with? And we just start programming ourselves and just making the movie bigger and worse than what it really is. So what's some of the advice that you give to the parents and the caregivers that go to you that are falling apart, that are really feeling the toll of everything that they're having to deal with right now with their babies?
First of all, that it's normal. That's normal. Feeling like the world's falling, that's normal. It's normal. It's a very big change in their lives, but also that there's hope. And that their child is different, like Temple Grandin says, they're not any less than any other child. Mm-hmm. And they have as much potential to go to high school and college and run a business as any other child.
Right. Yeah, she's a perfect example.
That's my biggest message.
Of a person.
Of course, autism doesn't look the same across. When I make comments like that, I want to make sure that I say that I speak to the higher functioning population, because we also know that there are individuals on the spectrum that have intellectual disability, severe, nonverbal, that need so there are very severe cases that require much more in-depth care, which have more limitations, right? So I'm also very aware of that.
Right. Okay, so this is all very valuable information, you know, and like I was talking to you earlier before we started the podcast. I'm very grateful that you're sitting here and talking with us. It's almost like a little bit of a taboo subject, I think, you know, because nobody wants to say my child is autistic, you know, and when you were a teacher and you were working for the public education system, you were noticing certain things that were off with certain children, and I'm sure parents notice the same thing, but they don't want to. They don't want to say it's mine. Mine has that problem also.
And let me say this, because I, as a clinician now, and you know, I mostly now diagnose. That's mostly what I do right now. I'm only diagnosing, and I have to say that a trend that I'm noticing is girls in the middle ages coming to me for a diagnosis at 11, 12, 13 that were completely fell through the cracks. And I'm also seeing a lot of adults in their 30s coming to me for a diagnosis.
And why is that happening? What are they noticing?
Because
what do they tell you?
Monica, remember what I said earlier? There are cases, there's a boy that could be born where they walk at 12 months, they talk.
And then the regression
And then
starts.
they go to elementary school, they may be quiet, shy. No, he's just quiet, shy.
Right.
He likes
He's
to be
introverted.
alone. He's introverted. They get to middle school. No, they're just, it's a new school. High school, they start having panic attacks, depression. Society expectations went too high, and now they can't keep up anymore.
That's it right there too. I
so
think
there's
that
case.
Yeah, I
Remember,
think that just the expectations.
And you don't need language delay to have autism. That's the biggest thing here.
Right.
You can have a child that spoke like a typical child and has it.
Right.
So that's the other thing is girls are wired to be more social. By the time we're 3 or 4, mira la muñeca. They get to school, el bebé va a mimir. So the girls pretend to be social, but they're not. And then you get girls with autism that pretend to be social.
And the parents think that she's okay or
because
don't notice
they're pretending,
off.
which is called, you know, you'll hear the term quote unquote masking. And they're just camouflaging. And what you tend to see in these girls,
but they're not doing it intentionally either. That's just
they're
something
doing it to survive society.
And it's a biological reaction that they may have as females as well.
But this is what happens. You have these girls that now start camouflaging, right? So they start pretending that they're social, but they're not.
Right.
No le nace. It's not innate. When they get home, they're tired. They're anxious.
Because they're acting all day long.
They're crying. They're screaming. They're having temper tantrums. They're depressed. They're self-harming. Yeah, that's what happens.
Is there medication that's given to...
Sure, yeah. Actually, we have to remember that, you know, autism spectrum disorder is the underlying mechanism is anxiety. These kids are hyperactive, not all hyperactive, but there's hyperactivity in the brain. So they tend to be very anxious individuals, and they have a higher risk of having depression too.
Right.
So in some cases, not all, some of these, you know, some kids may do better with an SSRI for depression, for the anxiety. There are cases with oppositional defiance and the disruptive mood disorders that require psychotic medication for managing very severe behaviors.
That's very rare, right? That's
no, actually, it's not rare. It's
really?
It's also common in autism. Remember, it's a spectrum, so we see all of
everything, a little bit of everything.
My specialization in treatment and in diagnosing is the higher functioning population, but I've worked with it all, with the whole gamut. Pretty much.
Well, you're doing a fantastic job. I know.
Thank you, my friend.
Yes.
I love what I do. It's taken me a long time,
That's what I was just gonna
but
say.
I did it. Oprah Winfrey, I did it. You're my next interview.
You are. You know, you've been wanting to do this forever. I know what a daunting toll this has been on you, on your family, your husband, your children, and you never gave up. And I've always said, my God, this woman has a tenacity. God
and
bless
you
her
were
soul.
one of my biggest motivators. You
God
were
bless-
always
I
there.
don't think that I could do what you did, and I consider myself a pretty strong woman.
But you're doing your own version of it.
But still, I really...
Well, I can't do what you're doing. I can't do this. I see you with your... I can't do that.
With my podcast and all the
No.
equipment that was falling apart as I was
can't
getting
do
to your
that.
house.
I see that like, wow.
It's fun, and I love being able to just, you know, show. It's what I say. You know what? I'm no Oprah Winfrey by any means. I'm not trying to be. I'm not trying to compete. But I do believe, because it happened with me, that through the information that we're putting out there, it might be one person, it might be 5, it might be 20, but you're talking to somebody and you will reach somebody that will make a difference.
I hope.
And maybe that parent that's struggling, that's crying at night right now because they notice that there is a problem with their child, but they don't want to admit to it. They don't want to come forward with it. You don't know. Listen, there's still a lot of these Hispanic macho men. No, not my son. My son is absolutely fine. Eso se le pasa. He's going to be okay. She's going to be okay. But a mother knows, a mother feels. And that's where we have to be okay with just getting the attention and the help.
Because the earlier you get the help, they're going to do so
that
much
child
better.
Does have chance at life, a real shot at life, to be able to have as normal as possible of a life. You know, because this world is pretty darn difficult, as we know, and we don't need to continue to add to that.
And, and I encourage people to open their minds to neurodiversity, because if we choose to see people, Monica, by what their strengths and weaknesses are, we can get a lot more from each other.
Absolutely. We can learn from each other. We're learning from each other every single day. And before we end this, I want to leave it, and I really want you to be as open and as honest as you possibly can talking to your buddy Monica here.
Yeah.
And I really want you to tell me, we've talked about how difficult this has been for you, how challenging, how much work you've put into this, because you've put your heart and your soul into this. Why is Yelina, why is Dr. Fernandez doing what she's doing? Why have you worked so hard? What are you trying to achieve? What's the legacy that you want to leave behind with the work that you're bringing, that you're putting out there? Talk to us a little bit about that.
Monica, one of the questions I get asked a lot, because through my training I've done so many presentations at, City of Miami, or for law enforcement, or at schools, or for parents, and people always tell me, wow, when you speak about autism, you get so excited, you get so passionate.
You light up.
And I always say, oh yeah, I can talk about it for hours. And I can read about it for hours too. And people say, how did you have a child on the spectrum? I'm like, no, I don't. So because I've been asked this question so much, and my typical answer is, I don't know, it just follows me. Like, it just follows me, and I love it. But I've actually never shared this with anyone, but I've given it more thought and more reflection, and I'm actually convinced. You see, just a little snippet about me. I grew up in Hialeah with my amazing mom and dad and my brother.
305.
Right, in a duplex across the street from Monica. And in the duplex, my mommy, my brother, and then next door lived my grandmother and my aunt. And when I was a little girl, all I knew was that my dad always took care of my mom, my grandmother, and my aunt, his younger sister, Miriam. Mm-hmm. Well, Miriam and I, my tia Miriam, was my world. She was who I loved the most. I was very close to my mom. I have a great mom, but when I would get home from school, I would run next door, and she was exciting, and she, she loved animals, and we would go on walks all the time and explore the neighborhood, and she taught me how to plant vegetables, and she told me when I was a little girl, we would be planting, peppers, and she would say, Yelina, you have to give to the world so you can get back. And she planted all of these
seeds in
me, and I lost her at a very, I lost her to cancer during my early 20s. My Aunt Miriam was diagnosed with schizophrenia. She was also isolated from the family.
Right.
Not many people wanted to be around her because
she was odd, because she was different.
She was odd, and she was awkward, and she would make very literal comments and offensive. I've spoken, and I've gotten many anecdotal notes from my family. I am almost convinced that my aunt had autism spectrum disorder.
Sure. And especially at a time where it wasn't as popular, right?
It was not well known, but, when I think back now, to her repetitive behavior.
With all the education that you have in the field.
Yes, and she used to paint inside the house repetitively, and I loved it because I would paint with her, and I knew everybody at the hardware store. So much of my happiness and the good in me comes from her. I hope, Monica, to help as many people as I can with autism to make it through life okay.
And I believe
Yes.
from the bottom of my heart that you will. I do. I really do. I've known you forever, and you can feel the passion. You can feel the love in what you're doing. And you know what? You're one of the lucky ones, my friend, because not a lot of people get to sit in the seat that you're in right now, where you're actually living your purpose and your true authenticity. You know, and you've worked your ass off for this, my friend. You're a badass.
I love you.
Okay? So thank you, thank you, thank you. You know, we've had a little bit of rain out here. We're sitting in her backyard. She's got to go pick up her son.
Yes.
So this is a really quick podcast that we did. We've been meaning to do this, like I said, for a
I
couple of
welcome
months
the
now.
questions. You can bring me back. I can answer questions.
If you guys want to know anything in particular, you those that are watching, those that have any questions, concerns, leave some comments for us. I will share them with Dr. Fernandez so that she can get back to you. She can guide you in the right direction. Is there any special maybe websites that you can that a struggling parent can start reading about?
You know, Monica, what I can do is I can I can give you some that maybe you can share in the thing. That way I can add a few sites that can reach
That'll be good, and we can put it in the comments
different
section.
needs, because you know there's parents that need different things.
Right. And
So-
so I'll add some of that information in the comment section, just for you parents that would like a little bit more information. And again, Yelina, I can share any questions that you guys may have with her. I can then, send you some direct information if you'd like to contact her directly. But, I hope that we can revisit this topic again.
Anytime.
I know that you're very busy, and,
Anything for you,
And
my
the
friend.
next time that we do this, we'll have even more information. We can dive into different areas of autism and the spectrum, and just, for all you struggling parents.
And thank you, Monica, for giving this this information a platform.
Yes.
Thank you for doing that.
Okay, guys, thanks for watching the Bear Experiment podcast. I really, really appreciate your love, your support, and you can really support me to continue to put some valuable information out there by subscribing to the link below so that I can grow my channel, and liking this video and sharing it with others. Thank you again.